One of the greatest things that I think, can offer a patient is sitting there and listening to their story and literally holding their hand and loving them through this process. Oftentimes, they've never experienced that before. Getting a patient into a loving environment where they're really listened to and cared for has as much to do with their healing as doing the therapies themselves.
Let's ditch the quick fix and dive into today's conversation. Welcome, everybody. I'm joined today by Doctors Candice Owens and Dr. Stuart Nunnally. Dr. Candice Owens has practiced at Nunnally, Freeman, and Owens Dental Practice since 2008. Dr. Owens obtained her undergraduate degree from McMurray University in Abilene, Texas, and her doctorate in dental surgery at UT Health Science Center in San Antonio. While living in San Antonio, Dr. Owens established and led a refugee dental ministry and led several dental mission trips to Central America. Dr. Owens was an expert included in the Root Cause movie. Dr. Stuart Nunnally is a graduate of the University of Texas Health Science Center Dental School in San Antonio. He maintains an integrative biological dental practice in Marble Falls, Texas, where he and his partners have treated patients from all 50 states and 24 countries. Dr. Nunnally is a board certified in naturopathic medicine and is board certified in integrative biologic dental medicine. Dr. Nunnally is a well-known leader in biologic dentistry. He has been ahead of the curve on the effects of dental health on the entire body and its connection to disease. His practice specializes in mercury toxicity and removal, cavitations, and biocompatible restorations. Welcome, Dr. Candice Owens and Dr. Stuart Nunnally. Glad to have you here today.
Thank you for having us.
We're delighted to be here.
Yeah, I'm excited for this interview. I mentioned just briefly before we started recording, I am learning, and as you learn, you start thinking, wow, the mouth is a very complicated reality, and its impact on the overall health of the body is really, truly amazing. It's an amazing design, the human body, but sometimes you don't draw these connections. So I'm looking forward to you sharing with the listeners, the connections with oral health and overall health. So I thought it might be good to start with your own stories of how you each came to a more holistic approach to dental care.
I'll start because poor Candice got roped into it. But I got sick years ago, about 20 years ago. Right now, we would have thought I had ALS. I began to have neuromuscular issues. I was referred to the Lou Gehrig Center in Houston, and all of us, me most importantly, thinking that I had ALS. I did not. It was a mercury toxicity issue. At any rate, when I got the referral to Houston, I sought out anyone who could help me treat the disease, thinking that I had ALS. So I went to Montreal and saw the old grandfather of holistic dentistry named Hal Huggins. Okay. I saw him in Montreal because he had been seeing patients with all sorts of autoimmune issues for years. He had multiple degrees. He was a brilliant man, and he was willing to see me. So at that time, I went to see him. I had spent several weeks with him. And during that time, he had a dentist in Montreal take all of my existing dentistry out, all of which I had no more mercury, but I certainly had other restorations that were not biocompatible for me. So he serum tested me, found out what materials I was compatible with, had those replaced, had my cavitations cleaned out. And lo and behold, within a matter of weeks, I was beginning to feel better. And finally, we realized this was not ALS. This was a mercury toxicity issue. But at any rate, as a result of my relationship with Dr. Huggins and then shadowing him for much of the next year, he decided to start coming to our little hometown in Texas, Marble Falls, Texas. He got tired of being in the cold in Montreal. So he began to bring his sick patients to us quarterly here, and he did that for 8 years. So in the course of that, of course, our practice was totally transformed into a holistic or biological practice. Candice?
Well, luckily, Dr. Nunnally recovered and was able to continue to practice dentistry. And then this practice migrated into a more biological approach. So I was working in general dentistry, and I was working in a practice where I was seeing a lot of special needs adults were diagnosed with renal cell carcinoma. So that was pretty overwhelming to me, just only having a dental background. I had just enough medical background to be dangerous and ask a lot of questions. So in caring for them and being concerned about their course of treatment, I was trying to understand why. Like, why would two people both have renal cell carcinoma? Why is everybody so focused on just surgery? We just need to take out the kidney and you'll live, or if it spreads, you're going to die, is what I was told about both of them within a short period of time. So I started to dig in and try to understand what might cause that. And then it just started to unfold about nutrition and toxicity. This Dr. Jerry Teague was watching this happen, and he mentioned to me, I really think you should meet my friends, Stuart, Nunnally, and Lane Freeman. And I was hesitant. I had kind of my own plan. I had not grown up in any type of seeing holistic practitioners or chiropractors, or I had no reference point to anything, in the scope of what I do now. Yes, a totally new world. So I very hesitantly came to meet Dr. Nunnally. And of course, it was a wonderful experience meeting him and Dr. Freeman and being in our environment. So it was very warm, but it was very foreign to me. So he gave me a couple of books. And then I didn't even realize that I'm in the back of the clinic sitting across from Dr. Hal Huggins, eating a salad or hanging out. And he is sharing with me the huge impact that biological dentistry can have on patients, and that there's a different way. And the rest is just really history. I came and joined them a couple of days a week, and then have been able to mentor under he and Dr. Freeman. And I just couldn't imagine practicing dentistry any other way.
So how long have you been with, I think we mentioned how long have you been in the practice now?
In 2008, I joined them. Yeah. So I was only out of holistic practice for just a couple of years. Once I was out of dental school, I've been able to be in this environment more.
Yeah.
She was brave. She was very brave because at that time, we were still catching some heat for practicing a little bit outside the box and questioning our traditional training. And I think for the most part, we've persevered through that, and the heat has lessened. But at that point, I'm so thankful that Candice, basically, I think the Lord just led her here, and she had the strength to say this is almost practice along these lines, because we're trying to seek out what's really truthful and what's right for a patient, and not be, the main thing is we don't want to, this Hippocratic oath of doing no harm is very, very important to us. And so at any rate, a lot of what we do in dentistry, and I think a lot of the way we're trained, is harmful, not only in terms of the materials we use, which many of them have a toxicity associated with it, but far too many teeth are over-prepped for crowns and so forth, when we could have done a nice conservative bonding that would have saved the tooth for decades. So at any rate, I'm so glad she joined us.
It's awesome. And, I know, part of the struggle is that you have a system in place, and the system kind of dictates the process. And it's hard to kind of break away from that. Good intentions and great doctors that are performing the dental work, but you're kind of roped into that system, and then to break away from that is a challenge. To try to do a little bit more conservatively. So I appreciate that. You kind of mentioned the renal kind of issue that kind of gave you that kind of question mark. What are some of the other conditions that you see associated? I know there's several, but if you can list a few of the conditions that are associated with oral health. ALS was one, the renal condition, Lyme's disease. What are some of the other conditions that you see associated?
Lyme was one that first came to mind. We see so many patients recovering from Lyme, and then a lot of Hashimoto's, hypothyroidism. I think mercury is probably a very big culprit in that. People wanting to detoxify. Oftentimes people who have chronic sinus conditions, gut-related conditions, because, the oral microbiome being an extension of the digestive tract, and then looping into root canal treated teeth that are infected, and the fact that those toxins can be introduced in the body. And so it's difficult to tease out individual diseases because the mouth has such a big impact on every system.
I think, Damon, when I see a patient with lupus and rheumatoid and many, many other autoimmune diseases, MS, I begin to look immediately for teeth, for toxicity issues in the mouth. And many times those diseases are very much related to the inflammatory response that we get either from periodontal disease or from root canal treated teeth or from cavitated areas in the jawbone. And we, of course, we know when we eliminate those sources of toxins, we almost immediately lower the patient's overall inflammatory response. And we can see that through C-reactive protein levels that will begin to drop. It's interesting. And rheumatoid and lupus, to me, I almost think of those as a dental disease. And when we see those patients early on, oftentimes, especially if they have an area of dental toxicity and we relieve it, those particular conditions oftentimes improve very, very quickly.
Well, and in my preparation for this interview, I saw that you have treated people for plantar fasciitis, back pain. You're seeing a connection with breast cancer. Part of the presentations that you've been able to help as well, right?
Well, there are physicians around the world who have noticed this correlation between root canal treated teeth and breast cancer. I can't personally say that. We don't get to track these patients, but many, many of these cancer clinics have noticed over the years, especially if they have a holistic side to them. I think these are anecdotal, but many of the physicians who refer to us will say that that correlates at a 95% or greater level. Well, we take that seriously. We're not making that claim. We're not going to tell you that a root canal is going to cause breast cancer, but there are physicians who have recognized that correlation and they've written about it over the years. And we know that root canal treated teeth, for example, will block the meridians that are associated with the energy flow to various organs. That's certainly well known in most of the world. It's not that well known in the United States, but most of the rest of the world that acknowledges Eastern medicine and acupuncture meridians and so forth would say, yes, of course, that makes perfect sense. Yeah. So there's not only the issue of toxicity, there's also the issue of energy flow, right, and breaking those channels up and the disease that can cause.
I was going to say many chiropractors would probably be in agreement with that theory as well. So how has COVID impacted your dental practice over the last 19 months?
I think that the place that we're seeing it show the most damage, with patients finally being able to return, is when we go do our hygiene checks. And it's just a combination of, obviously the whole situation's been really hard. Here in Texas, we were closed for a pretty short period of time, but across the country, I know there have been a lot of people who haven't even had access to dental care. It really kind of almost feels like the perfect storm, because you've got people who are masking and then maybe not making the best nutritional decisions too, with the stress and all that's ensued. And then not had access to come in to have their dental cleanings. So when we go over for a hygiene check, there are a group of patients that seem to have more periodontal disease or gingivitis. The way that a mask can impact that, if I see somebody who's in their car with their mask on or exercising with their mask, I have a lot of thoughts, but one that really comes to mind is, oh my goodness, take that off, because you're disrupting your breathing patterns. You're changing the oral microbiome because of the xerostomia, or the dry mouth that will happen being in a mask for a long time. You're probably not drinking as much water having the mask on. And I really feel for people who don't have choice in the matter, for their work or for whatever reason they're having to wear it.
Right.
But they've probably noticed changes in the way their mouth feels or their breath or more bleeding, when they're flossing or water picking. But I think that's the biggest impact is we're seeing changes. We are able to take plaque samples and we use a phase contrast microscope to actually see what type of bacteria are present in the mouth.
Okay.
And people who may have come in before COVID in one state, many times it's not looking as good, either because they've missed their appointments or they've been wearing a mask more, there's been more stress. And that distresses us because this is a time when you really need your lungs to be healthy. And these shifts in the microbiome, it's well documented that can impact your lungs. And also Dr. Nunnally can loop in here, just inflammation in the body.
Yeah, and I would, there's actually, it's hard to believe this, but there's a term used in the literature now called mask mouth. And we've seen this amped up levels of periodontal disease as a result of people masking. And we know, and the papers are so clear on this, I would just tell your audience, whatever you do, get your mask off. There's no a mask, the pore size of a mask is 200 to 800 times the size of a COVID variant. They go through there like a freeway. So what you do, though, is you do trap your own bacteria in the mask. And of course, no one wears these as a surgeon does, where they don't ever touch their mask until they're ready to take it off or put on a new one. People carry these masks around for weeks at a time in their purse and in their pocket and then slip it on. And it's just full of bacteria. And so, and the warmth and the humidity of the mouth then saturates the mask, and you have this beautiful petri dish of bacteria.
Beautiful petri dish.
Yeah, it really is. And so that's why we're seeing this increased amount of periodontal disease. And there are 2 new papers right now just published, both of them identifying the impact of periodontal disease on the morbidity and mortality of COVID. So people need to get their masks off.
I think it's good that they also understand that a biological dental office is really it's a safe place. I think I can say that with confidence, to come and have these things taken care of, because for so long we've had extra filtration because of our heightened awareness of mercury vapor. We use ozone in our practice. And so I understand if you're a patient more at risk of having a complication from COVID, that you might have been hesitant early on to
Sure.
come to the dental office. It sounds scary. There might be aerosol, particles, but we just really want to encourage people to not walk in fear, related to that anymore. It's more important that they come and have their teeth cleaned and take care of their teeth, because if they don't, then they're actually kind of heading in the direction of what the fear is driving towards less wellness.
Yeah, weakened immune system, and the immune system being weakened not only from the stress, but from the bacteria overload, really does make them more vulnerable to any pathogen, really. I mean, that's kind of the sad part. And then there's the fear that there's nothing else, and I'm going to be careful here about a mask and vaccine to take care of you, when there's all kinds of things they can do to support their immune system and have something in their go-to cabinet. But that might be a little bit of a digression. So
it's okay.
I thought maybe let's touch on cavitations and root canals, maybe combine those together, and amalgams, if you want to kind of loop those together. And then we might get into, what's the treatment you do in your office and what is the home care that people can do. So why don't we start with what you're working with a lot? And
why don't I take root canals and you take cavitations?
That sounds good.
Root canals, even among holistic dentists, I would say this is the most controversial area of what we do, because we have physicians who refer patients to us every day who want to have their root canal treated teeth removed. And the reason they do is because they've seen such changes in their systemic health for the better when they get these areas of toxicity removed. A root canal treated tooth, by definition, is an infected tooth. You cannot sterilize a tooth by taking the nerve and the bacteria out of it, because there are too many little nooks and crannies in the tooth that we, as dentists, the endodontist or the general dentist, cannot get to when they do a root canal. So by definition, when a root canal is done, it's basically a dead tooth, no more blood supply to it, but it still harbors bacteria. There are too many little canals for a dentist to get to. Well, that's the perfect scenario for a toxicity, because the bacteria, most of which are gram-negative bacteria, which produce potent toxins, now has this environment where we can't deliver our own immune defenses to it because the blood supply has been severed. So it's a wonderful incubator for bacteria, and those toxins do not just stay in the tooth. They leach out into the bloodstream and they go wherever they wish. This is very, very well documented in the literature now. In fact, this is some interesting data. We now have cone beam technology, which allows us to see teeth in 3 dimensions. There have been 17 studies worldwide to determine how often a root canal treated tooth has an infection on it that we can't see with a regular 2-dimensional X-ray. In those studies, 40% of all the root canal treated teeth had an obvious infection on the cone beam. Another study says that if you see an obvious infection on a root canal treated tooth, you have a 530% increased risk of a cardiovascular event.
Oof.
And we know that in this country this year, 25 million root canals will be treated. 25 million teeth will be treated with root canals. Well, if the data is true, and 40% of those, or 10 million, develop these lesions on them, which are blatant abscesses, that predisposes 10 million people to a heart attack. They have a 530% increased risk of a cardiovascular event. And it's not just heart attacks, it's strokes. For example, there are a number of papers now where when the surgeon got to the area of the stroke and they opened it up, they took a sample of it, looked at it under the microscope. It's the exact same bacteria as you have from the root canal. And the same is true. You can take during bypass surgery a sample of that material from the atherosclerotic plaque. You can take a sample of that, look at it under the microscope, and identify it's the same bacteria that were in the root canal. So we have hard data on this, and not only to mention just cardiovascular events and stroke. Now these toxins that are leached from what we call leaky teeth or root canal teeth are associated with Alzheimer's disease. They're associated with depression. And I'm not talking about just mild depression, severe depression. They're associated with other autoimmune diseases. So this particular body of data is becoming so convincing in my mind that it's very difficult for me to imagine doing root canal therapy anymore.
So just a quick question on that. It caused me to ask or have the thought, and I don't know if I've listened to you before or anybody else. Has it been established that these pathogens, these bacteria, can cross a blood-brain barrier at all?
I don't know that, not likely that the pathogens would cross, but certainly the toxins can. We know the toxins do.
Okay.
Yeah, that's known.
So it's probably a lesser known source of hidden infection. I don't remember, I obviously learned how to do root canals in dental school, but I never saw anybody mention or show me an area of cavitated bone until I came to shadow Dr. Nunnally at those times when Hal Huggins was here with his patients. So it was interesting and kind of shocking to me. You know, the first time I stood over him and I watched him open up a site where a cavitation is statistically most common happens in an area where wisdom teeth or third molars are taken out. And the first time that I saw one done, Dr. Nunnally was opening up that particular location. So we do use cone beam CT technology now, we have that. And that's the best diagnostic tool that we have when patients come in and they're curious if they have dental cavitations. Many times their integrative practitioners have sent them because it's of a high priority to them that we identify if that source of hidden infection is present so that we can resolve it for the patient. And the way I typically explain it is that's going to free the body up to not be struggling, with that toxicity, to help them in some of the other treatments that they're pursuing. So as a patient sits down, typically we pull up that cone beam CT. We show them the areas where their third molars were removed, and we show them the density of the bone. That many times it looks different, like there's a ghost image in a large situation of where the tooth was taken out and the healing was not complete. Sometimes it's difficult for the patient to see. Sometimes it's difficult for the dentist to see because you're just looking for nuances,
Yes.
there.
Yes.
It's typically a painless situation for the patient. There's different types of cavitations. Dr. Nunnally has been on many expert panels talking about the cavitations that cause facial pain, which have a little different terminology. But I would say the majority of the ones that I see in the practice are painless. We identify them on the cone beam. Our patients, we have a pretty specific protocol that follows, how we treat and resolve them. Our patients are typically moderately conscious sedated because we want the body to be in a very relaxed healing state. We have acupressurists that work with us prior to us even seeing the patient. And then we use epinephrine-free anesthetic to numb the area, make a small incision to open where we see the cavitation approximately on the cone beam, drop in to that weakened bone gently. We want to gently clean out the bone that is not healthy in that site where they didn't have complete healing. We use saline and ozone to fumigate and kill any bacteria that were present there. And then we draw the patient's blood while they're very relaxed, after they've been sedated.
Yes.
Spin it in a centrifuge to get the platelet-rich fibrin layer and take small pieces of platelet-rich fibrin and pack those into that area where the cavitated bone was to stimulate their fibroblasts to make more collagen and then in turn heal that bone. And we do see really great results with that. Dr. Nunnally has been doing this for a very long time. And you want to add anything?
No, I think you covered it. When we first started doing this years ago, the cure rate was not that good. In fact, you'll still see in the literature that cavitations reoccur 40% of the time when surgically treated. But we know now that that's not true because using ozone, using high dose vitamin C, using platelets, all of that, we think we've reduced those failures down to probably, I would think, less than 1%.
So in a very simple kind of summary, you've got an area that's avascular in a root canal for consideration, but in a cavitation you still have the vascular opportunities there. Is that correct?
Yes, but it's sluggish. The blood flow to a cavitated area is always sluggish. And certain areas of that oftentimes will be necrotic where there has not been blood flow.
So where you put this platelet material in a non-vascular area, it still has the potential to stop the infected nature of that area, even being avascular.
Yeah, it does, but before we leave the area, once we've curated that, we'll make sure that it has robust blood flow, so that we can do that. We can stimulate the area. We can clean it out and get into areas that are vascular, so that we introduce blood flow to it.
Isn't that awesome? The body's designed to be able to do that.
It's beautiful.
I share it with patients all the time that, the body's always, people say, I'm just getting old. And I say, well, I'm probably in a little bit of denial because I'm in my 60s. But I tell people that I don't have any bone tissue in my body more than 7 to 10 years old. So I'm still pretty young. So
That's good.
And it's pretty cool how the body is able to rebuild and repair when you give it an opportunity in a good environment, if you will.
Oh, it's wonderful.
So what are some of the other things that you do in the office for oral care outside of surgical recommendations or just in general?
We always try to educate our patients on making really good nutritional decisions because that can have a huge impact on oral health. And many of our patients too have a lot of knowledge about that, or they're under the care of another, like a chiropractor or a functional physician. And so sometimes they even educate me. They tell me about a new supplement or some really, cool thing that they've done to help have more bioavailability or remineralize an area. So that's a big component. But something really simple is using the water pick. I think a lot of times people come in with this mindset that they need to be a flosser, and we're not going to take somebody's floss away from them, but we do really want to encourage them to use a water pick to irrigate at home. I think that's really empowering to know that they can influence the microbiome with something simple like peroxide added. We have a little recipe card of some different suggestions that can be used for irrigation. And that has not just an impact on the teeth, but the whole rest of the body. And then,
just so your audience will know, Damon, the very simple thing of taking an ounce of 3% hydrogen peroxide and putting that into the water bath, say 7 or 8 ounces of water, that combination, using that in an irrigator or water pick is really about as strong as they can stand it,
right?
Where they're literally flushing out the little gap between the tooth and the gum, can have a tremendous impact on their systemic health and their oral health. And
are you recommending that to patients on a daily basis, or 3 times a week, or how do you typically recommend those types of home therapies?
We do recommend that they do it daily. Yes. I think it's just a really good practice. And then, at first, when you recommend something daily, people might do it 3 times a week. And then we try to encourage them in that. Just the more they can do it, they can form that good habit. And then, as a lot of habits go, once they get in it, then they don't feel like their teeth are clean if they're not doing that. It just kind of becomes okay, I have to do this now.
Right. Gotcha. So what are some of the other home remedies that you recommend for a person to do that's a little bit less toxic, as far as toothpaste or other oral health care?
Well, as far as toothpaste goes, basically any toothpaste that doesn't have fluoride in it would be our choice. Fluoride and sodium lauryl sulfate, SLS, would be the 2 main ingredients in toothpaste that we think should be avoided. Fluoride primarily because it's such an aggressive atom. If you look at a periodic table, it's at the very top right-hand corner of the period. Well, it's the most active element on the periodic table. And it's among that group of elements called halogens. And one of those groups of halogens that's so important in our body is iodine. Well, fluoride or fluorine will outcompete for the sites that iodine binds to every time. It's such an aggressive atom. So we want to eliminate fluoride as much as possible for thyroid health. Our thyroid hormones depend on iodine, and you do not want to have fluoride binding to your thyroid hormones instead of iodine. But iodine is in every single cell in your body. And so as much as you can prevent and not use and not be exposed to fluoride, you want to do that. And then and sodium lauryl sulfate is what makes toothpaste sudsy. It's what makes your soap sudsy. And it's one thing to have it on your skin, but when you introduce it systemically, I think we see nothing makes the mouth break out more or have ulcers more than SLS, sodium lauryl sulfate. So you want to try to avoid that.
Artificial sweeteners too.
There we go. Beautiful.
Yeah. A lot of those conventional toothpastes are going to have artificial sweeteners that I definitely wouldn't want my kiddos to have. I don't want to have it either. But you can find toothpaste that's in a tube that has better alternatives, to give it a better taste.
And too, as far as your listeners go, Damon, just they can make their own toothpaste with a little bit of.
Can I ask about that?
Oh, why don't you give them the recipe?
Sure, you can. You can kind of put your own spin on it, but the base is using some baking soda. You can use some pink salt, and I think we have this on our website too. If people are not wanting to jot it down, and have that in a mixture. Have some peroxide to wet the brush and brush with that. And they may have heard over the years that that's too abrasive, but that's just, in our opinion, that's really not the case. There's abrasives in conventional toothpaste, and even things like microbeads, all kinds of yucky stuff that you just really don't want to get into. Some patients will even incorporate coconut oil, essential oils. You can kind of mix it up and make something that really suits you.
What's your thoughts on the typical mouthwash out there on oral health or things that have a little bit of a higher alcohol content?
Well, that's a great question, because there is some data that using a powerful mouthwash can be helpful in terms of COVID prevention. And there have been some wonderful integrative physicians who have suggested that. And I think that might be okay for a time. But the problem with traditional mouthwashes is that they have a high alcohol content, and they tend to literally nuke the oral microbiome. We do not want to do that. It's like putting an antibiotic in your gut and nuking the microbiome of the gut. So, in fact, and now there's great data to show that these commensal bacteria, the bacteria that are in the mouth, especially at the backside of the tongue, are instrumental in helping us to form nitric oxide, which is a vasodilator, which helps lower pressure. So there are several studies that show now just using mouthwash can raise your your systolic and your diastolic blood pressure by several points.
Right.
So you really want to avoid the traditional high alcohol mouthwashes.
I'm familiar with that. And as we're talking, I'm connecting a dot or two that maybe you may or may not agree with. So I'm going to put it out there. You have a patient who's trying to take care of their oral health conventionally. They've had the root canal, they've had the cavitation. We find that those can lead to a situation that you said can have a 500% increase in, some type of a cardiovascular condition. So then also they're trying to take care of their mouth with mouthwash and fluoride and all these things, which also inhibit nitric oxide. And that's what I, was sitting there going, man, you're doing all these things, thinking that you're doing something well. And, even if you tried to take good care of your teeth, you might have a root canal. You might get, smacked in the face like the movie Root Cause starts out with, and you're just kind of going down this road that's really leading to poor health and you don't know why. Is that kind of a fair connect the dot?
That's a very fair connect the dot. And what happens is we usually see patients when they're on the rear end of that spectrum. They've already seen a host of other physicians, and they've been across the country to Europe and you name it, looking for, what's the missing piece of this puzzle? And oftentimes, a good holistic dentist can listen to that history, and then with the use of cone beam and so forth, we can look and we can see these occult infections that no one has ever identified before. And then that's many times we're always here still surprised at how often that is a very significant piece of the puzzle. Sometimes it's 10%, sometimes it's 90% of the whole situation, but it's a percent that's often overlooked. And that's the joy of doing what we do, is we get to see some very significant changes in people's health.
So, and as we're kind of getting close to wrapping up here, it leads to what I think is a good comment towards the end of an interview, where are you at and in taking patients, and how do people get a hold of you?
Well, we're glad to see new patients, and we've been blessed to have quite a few coming from all over the country, and Dr. Nunnally sees them even from all over the world. So the best place to find us would be out on our website. And so I'm sure you guys will link in that information, Healthy Smiles for Life. Yeah. And that's probably our largest presence other than Dr. Nunnally's teaching and us speaking to people through podcasts. So, yeah.
So what is a typical experience for somebody that lives 2 or 3 states away? What could they expect if they were saying, hey, I really want to at least have a phone call get started? What would that patient visit encounter kind of look like typically?
They'll begin by speaking to one of our coordinators. We have coordinators who help coordinate our out-of-state and out-of-country patients. And typically those patients send a panoramic X-ray to us. It's not easy to manipulate the software and to open up these huge files associated with cone beams. So we really prefer a patient just send a panoramic image, and that can go easily over the internet. And then our coordinators get with each of the doctors. We go over those, and we then formulate a treatment plan just off of their X-ray. It'll be real close to what they would actually experience. And then before we do their dentistry, when they arrive in Marble Falls, then we do go through a very detailed exam, change any aspects of that treatment plan that we have made off of their panoramic X-ray. And now by then we will have benefit of a cone beam that we've taken in our office, which is a beautiful 3D X-ray. Well, we create the treatment plan right there, finalize it, and then usually the following day, we typically do all of their dentistry in one visit. We'll sedate the patient. We like the idea of removing all of the toxicities at once. It doesn't have to be that way, but if you're traveling from Germany and you want to get everything done in one time, we think it's by far the best way. So we'll sedate them, do all the dentistry. We have them there for a day or two afterwards, do follow-up therapies in terms of acupressure, more vitamin C and so forth. And then they're on their way. And we try to hand them off to someone who's holistic in their area. And but that's the basic way folks enter our practice and have treatment.
Well, and that's why I asked the question. It might seem daunting, but it sounds like you've got a process that is not so daunting, that will work well. And obviously you've had time to fine tune that. Any other kind of thoughts that you wanted to share before we say goodbye?
I'm really glad that we talked about the oral COVID and, mask wearing and trying to lean into some self-care that's not fear propagating, and just the positive impact that could have on patients. I'm glad you asked us about that, because it's not something that we often bring up when a patient's right in front of us, because we do want them to feel comfortable in the environment. But sometimes there's things we'd like to share about how they could optimize their defenses against COVID by taking care of their mouth. So I appreciate that you asked that.
And I think finally too, Damon, I think the therapies that we offer are fabulous. We've just keep tweaking and adding everything that we can from a scientific standpoint to the therapies. But even more important than that is listening to a patient, especially when they have been everywhere trying to uncover what on earth could be causing this decline in my systemic health. One of the greatest things that we, I think, can offer a patient is sitting there and listening to their story and literally holding their hand and loving them through this process. Oftentimes they've never experienced that before. And so I think getting a patient into a loving environment where they're really listened to and cared for has as much to do with their healing as doing the therapies themselves.
I'm totally with you. So, hey, well, I'm just very thankful for your joining us today in that thought line of trying to stay away from fear. That's kind of the thought from scripture comes to mind for me, is to be strong and courageous. And so we'll end with that. How about if everybody try to be strong and courageous today? And thank you.
I love that scripture.
Awesome.
Yeah, that's beautiful.
All
Okay,
right.
well, thank you so much.
All right. Have a great day.
Thank
All
you.
right.